The purpose of this video is to make physicians comfortable injecting PRP. We're going to do this by going over the safety and efficacy for platelet-rich plasma as it pertains to orthopedic conditions. A quick search on PubMed for platelet-rich plasma reveals over 11,000 hits. So clearly there's a lot of science out there, but how do you know they're good studies? This is where evidence-based medicine comes into play. They typically use these schematics, pyramids. The higher up the pyramid, the more we trust the study. At the bottom of the pyramids will be in vitro studies and opinion pieces. These are still evidence, they're just not the best evidence. Long considered the gold standard is the randomized controlled trial, and there are many of them for platelet-rich plasma. But it turns out they're actually not the best evidence available. If you look at this pyramid, and many others, you'll notice the randomized controlled trial isn't the top of the pyramid. In this instance, it's fourth from the top. The top of the pyramid is always something called a systematic review or a meta-analysis. And these are studies that don't enroll patients. Instead, they pose a question. And that question might be, does PRP work in humans for knee arthritis? Then they'll go through the literature, find studies that meet their criteria. And their criteria may be, we only look at randomized controlled trials. And then they'll combine those trials into one big study. Well, guess what? There are meta-analyses looking at PRP use in humans for knee arthritis. This one, performed by academics with no conflict of interest, only looked at randomized controlled trials. They found 14 trials that met their criteria. Combined, that's over 1,400 patients. What did they find? First, PRP was just as safe as other treatments. Second, PRP worked better than other treatments, including corticosteroids. And third, the effect lasts at least a year. And that's not the only meta-analysis. There's also this one, and 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 more. So clearly there's an overwhelming body of literature, but how do you go through it all? Well, fortunately, a group of academics, again with no conflict of interest, wrote a summary of the meta-analyses. And this summary of meta-analyses, what did they find? First, PRP poses no difference in risk to other treatments. And second, it works better in terms of pain relief and functional improvement. In summary, there is an overwhelming body of evidence that supports platelet-rich plasma is both safe and effective for orthopedic conditions.